Dose with Dr. Marianne Bowman. A viewer wants to know, what's a good way to treat migraines?
Migraine headaches can be very debilitating. The good news is that there are lots of different treatments to try to get them under control. A migraine headache is a vascular headache. It's a throbbing, boom, boom, boom type of headache. It can be on one side or the other, often associated with a visual change. Bright lights may bother the person. They may have nausea and vomiting, and some people get an aura of a sensation, maybe bright lights, sparkling lights before the headache actually comes on. Now, the treatments for these can be episodic. If you don't have them that often, then you take medications like Imitrex, Zomig, and these will help to abort the headache. Sometimes even at the very beginning, if you take something like Excedrin migraine, that does have caffeine in it, it has aspirin in it, and that can sometimes help. Sometimes Aleve, just at the very beginning when it's first starting, will take it away. But if those things don't work, you need the prescription medications like Imitrex, Zomig. There are a number of different ones. Some work better for one person than another. If you're continuing to have these headaches on a very regular basis, multiple times a week or a month, then your doctor may put you on something that is prophylactic, in other words, that keeps them away. One of the oldest ones that has been used for many, many years is Inderal. That will sometimes help. It's a heart medicine, but it helps with the headaches. Sometimes Verapamil is another one that will help. Sometimes we use anti-seizure medications. Topamax is one that sometimes helps. So your friend definitely needs to see the doctor. Talk, first of all, make sure that they are migraine headaches. Sometimes we have to do tests in order to document them, and we do some CAT scans or MRIs to make sure there's nothing else going on. Sometimes if you've had them for many years, you have the classic symptoms, you have a family history, then we know this is a migraine and we go right to treatment. So see the doctor, find out what are the alternatives, but if they are on a really regular basis, you might want to be on, or he might want to be on, one of these prophylactic medications that tends to keep them away. Good luck.
And if you have a question for Dr. Bowman, call the hotline at 841-9999 or email her at drbowman@news9.